Hello, everyone. My name is Dr. Sabrina Fabi. I'm a board-certified dermatologist practicing in San Diego, California. And the average patient that I treat is generally between the ages of 42 and 48, mainly women that are in menopause. And in my 16 years of practice, I've noticed that going through this transition of perimenopause, which is the time leading up to menopause, where there is 12 months of cessation of one's menstrual cycles, that perimenopausal period can last anywhere between 4 to 8 years. And so these women that I'm seeing in my practice, I would notice that there was significant age-related changes that would happen during this time that I didn't see happen for the years leading up to this time. And so this really has prompted me to incorporate a more holistic approach into the aesthetic journey of my patients, which generally includes during this time the simple question, are you in menopause or what's happening hormonally for you right now? Women generally don't know. And so in fact, about 1.2 billion women are entering menopause by 2030. There's about 47 million women that are entering this phase of life every single year. And this has increased for 26% versus 22% in the last 10 years, as the population is obviously growing. The biggest thing here is that 90% of women report that they were never taught about menopause in school. They're taught about perhaps the changes that happen as you enter and come out of puberty, but they don't necessarily get taught about menopause. And so there's an opportunity to teach this demographic, as they don't necessarily always know the symptoms that are associated with this transition in their life. And 60% of those that have been interviewed in a global survey that Galderma conducted have said that they're looking for information on what symptoms to expect. So some of the symptoms that I generally see in my patients as a dermatologist is the skin-related changes. I start to see that their skin doesn't look as dewy and moist as it once did, and that it looks a little thinner and crepier, depending on where they are in that perimenopausal journey. But my patients don't always make the association of those skin changes with their hormonal status. And so bridging that gap is really an opportunity that we all have as aesthetic providers. And so Galderma recently conducted a clinical survey. They looked at over 5 continents, 9 separate countries, and it was across the globe. They ultimately ended up getting about 4,300 surveys for women between the ages of 45 to 60. And here they were pretty much asking them about the symptoms that they were experiencing as a result of their menopause. And so this was really interesting because these women didn't always associate their skin-related changes with hormones. In fact, they generally didn't even know that skin-related changes could happen as a result of their hormonal change, because they usually associate, if I'm not having hot flashes, then I'm not going through a hormonal change. Hot flashes is what people generally associate with this time of life. So there was a very insightful survey. So out of the 4,300 folks that were surveyed, 54% of them actually were in perimenopause. So they had confirmed that they had not undergone 12 months of complete cessation of their menstrual cycles, but they were already starting to experience some of these changes. And 46% did report already losing their menstrual cycle and being in menopause. What was interesting in this survey is that what patients most noted from the changes that they were experiencing with their skin were fine lines and wrinkles being number 1, elasticity being number 2, and increased dryness being number 3. Now that is when we combine all of the results. But when you look at the perimenopausal group, they actually notice dryness first and wrinkles last. So wrinkles are more common in the menopausal group, dryness more common in the perimenopausal group. And that's very much what I see in my patients. The products that they once used, the lasers we were once doing, the injectables that we were once doing, maybe are just not doing enough like it used to. And they may need a different cadence in which they're coming into getting their aesthetic procedures, or adding more products to be able to get to the results that they want. What really kind of was enlightening for me was the impact that these skin changes specifically were having in our patients, because ultimately What we do is not about just effacing lines and wrinkles. It's about making people feel more confident in the skin that they're in. And so most of them felt less attractive. In fact, over 60% felt significantly less attractive as a result of the skin changes that they were experiencing, not the vasomotor symptoms, not the mood symptoms, specifically because of the skin changes that they were seeing, resulting in over 70% reporting feeling less confident about themselves, and a great deal of them reporting a lower mood. So there is an impact on the way we feel and show up as a result of these skin changes. Now, interestingly, what were they doing in order to improve these symptoms? The number one thing people do are actually food supplements. And second is a change in skincare, and then dietary changes. Hormone replacement was only found to be 17% of what these women did to combat the skin changes they were seeing, as many don't make the association. And medical aesthetic treatments were only 15% of what women did in order to combat the changes that they were seeing. When we asked them, what was the number one thing that you do in order to make the biggest difference in the skin changes you're seeing? Interestingly here, aesthetic procedures was the number one thing these women reported made the biggest difference in overcoming the skin-related changes of lines, wrinkles, dryness, and elasticity. So interestingly, there's a disconnect. There's a disconnect in understanding that hormones have an impact on the skin changes that one's seeing, and then what one can do effectively to actually address these changes. So this is something that's just reinforced what I think I see in my practice every single day. And so generally the conversation, at least for me in my practice, is what are you doing to address your hormonal shifts that you may be experiencing? Maybe the skincare that you were once doing in your 20s or 30s is no longer what's going to be enough to address your changes while you go through perimenopause and menopause. So we have that conversation. And then I encourage them to go see an integrative medicine doctor, because ultimately this is a holistic practice. It's not just hormones. It's hormones in the context of the individual, their past medical history, the medications they're on, thyroid disease, and other things that can influence the symptoms that they're seeing. So this is the practice of medicine. So I usually ask them to see someone that has that knowledge base to really comprehensively address the hormonal ratios that play a role in the changes that they're seeing. And then I generally tell them that there are a lot of procedures we can do. So one of my favorites is injectable Sculptra. This is FDA cleared to treat the fine lines and wrinkles, specifically of the cheeks. And so since wrinkles is the number one thing that is bothersome for especially the menopausal patient, this helps them a lot by stimulating that collagen and elastin that sometimes we see a decline in estrogen, progesterone, and oxytocin as a result of going into menopause has an impact on these patients. So this stimulates that collagen and elastin, and patients report not only looking better, but feeling better. And then I also like to recommend sometimes intradermal hyaluronic acid. This helps in drawing in more moisture into the skin, because if you remember, dryness is one of the number one things that is most bothersome for the perimenopausal patient. And then I also, we can't forget the neuromodulators that help with the lines and wrinkles that come from movement, especially along the glabella. And that is able to help with at least that portion of the line and wrinkles that are cumbersome to these patients. And then, of course, lasers. Perhaps most of my patients are usually already doing something for their skin cleaning every 6 months with perhaps a photofractional light. But here, as we start to shift into perimenopause and menopause, I generally do shift them into perhaps a fully ablative CO2 resurfacing to really boost that collagen, elastin, hyaluronic acid production that starts to decline as a function of hormonal decline. And so with that, guys, that sums up, at least for me, how I approach my perimenopausal and menopausal patient.